Okay, thank you. Thanks for having me for the invite. I know WSPS has been working quite closely with GovernWise, and we've developed a few different safety connections. This one in particular is related to workplace violence and harassment, and using that trauma-informed approach to sort of manage these situations and sort of how we integrate psychological health and safety into that trauma-informed workplace approach. So that's what I'm going to be talking about today. Hopefully, you know what you signed up for and you're happy to be here. So, taking a quick look at our agenda today. So, we're going to be talking about the current state of workplace violence and harassment in Canada. There's been a few recent studies that have been done, so we're going to be talking a little bit about that, as well as what are some of the contributing factors and some of the impact of hybrid work on workplace violence and harassment. We're going to look at how we can prevent violence and harassment in the workplace by focusing on psychological safety and looking through this topic with that psychological safety lens to sort of understand what's happening and how we can minimize that risk of mental harm. We're going to talk about what a trauma-informed approach is. We're going to talk about what accountability is with understanding. A trauma-informed approach does not mean that people are allowed to do whatever they want when they want, but we do have to approach it through a lens of understanding and non-judgment. We're going to look at some de-escalation strategies as well as a post-incident response. So sometimes these situations can leave us feeling shaken. They could have triggered something, from our past that really boils up to the surface and maybe causes us to act or respond in ways that we struggle with after the fact. So we're going to talk a little bit about what that can look like, and then also leave you with some resources, and we'll have time for some Q&A. All right, I'm assuming no questions yet. We're going to get right into this. So there was a 2022 survey that was done by Western University in conjunction with the University of Toronto and the Canadian Labour Congress. They surveyed over 5,000 workers across Canada, and these respondents indicated that 70% of them had experienced at least one incident of workplace violence or harassment in the last 2 years. This is staggering. I was shocked when I read this, and I think the surveyors were shocked when they received this feedback as well. And it's not to say I'm shocked that people are on the receiving end of workplace violence and harassment, but that prevalence of 70%, nearly, 2 out of every 3 workers in Ontario experiencing an incident of workplace violence and harassment over the last 2 years, that is a lot. And because of surveys like this, the government of Ontario, so the Ministry of Labour, Training, Immigration Skills Development, is really focusing on workplace violence and harassment as one of their priority areas of focus in the coming years, recognizing that these are significant harms to Ontario workers. And maybe I should just sort of back up 1 second. So WSPS, the organization that I work for, Workplace Safety and Prevention Services, we are a provincial organization in Ontario. So sometimes when I talk about legislation or things that are going on, it is very Ontario focused, although I know that these statistics are from across Canada, and I'm sure some of you maybe aren't located in Ontario right now, which is completely fine. It should still all be relevant. But that is sort of the customers that we typically serve are Ontario based. So that's the legislation that we speak to. So this is across sectors. These respondents were in various sectors, including education, including healthcare, manufacturing, retail service sector. I don't have the full list of all of the employers, but it was very cross-sectional. So it's not to say that this is only one sector or one area of, the workplace that we're looking at. The most common perpetrators of workplace violence and harassment were found to be third party, which means people that are not directly sort of employed or contract workers or volunteers at the workplace, but those customers, those patients, those individuals that were serving, even visitors to different workplaces would be considered third party. And also coworkers. Coworkers and colleagues were the second most common perpetrator. And we know that that happens. We know that we don't all work in environments where we get along with our coworkers and colleagues all of the time. There is conflict in every single workplace. And, sometimes conflict is okay if it's dealt with in a healthy way and we move on. But sometimes conflict isn't dealt with and it's allowed to fester. And that conflict can then turn into some of these incidents where there is harm. So some other studies have indicated that there's an increase in severity and frequency of workplace violence and harassment. There is an increased fear to report. So what that means is, well, we see this study and it was anonymous and people obviously felt quite comfortable responding and being truthful and sharing their experience. I would guarantee that if we looked at these workplaces across Canada, HR is not saying, oh, yeah, nearly 70% of our workers are reporting incidents of violence and harassment. That's not happening. So there is this huge disconnect between what is actually happening in that worker experience and what is being reported to and dealt with and investigated and controlled in workplaces. So if there is no reporting, if people are fearful or worried about reprisal or that it's going to be career limiting to report these incidents of violence and harassment, then workplaces, in fairness, are saying, well, we don't know about any of these. We don't know what's happening because they're not getting reported and nobody's saying anything. So that lack of reporting and underreporting is hugely concerning because we know when it comes to health and safety that employers invest resources and spend time and money in areas where there is the greatest risk. And if we don't know about that risk or employers aren't aware of incidents that are happening, it's more difficult to get those resources, funds, budget allocated to this area. There's also new harasser tactics. So things like cyberbullying with, our hybrid work environment. We're obviously doing this virtually. This probably isn't something that maybe we would have done, 5, 10 years ago before COVID. I certainly know I wasn't doing this as often pre-COVID. Um, but we're coming up with new ways to interact, to talk to people, and that involves, this risk of sort of sitting behind a computer and harassing individuals or discriminating or bullying. So lots of different harasser tactics. And I just also want to mention that this survey that was done in 2022 looked at the last 2 years. So that was during sort of prime COVID time, because I think these researchers are recognizing that something has changed. There's a difference. There is a marked increase in this uncivil, disrespectful violence and harassment in Ontario or Canadian workplaces, and something's changed since COVID. So let's take a look at maybe what is changing and what's going on. And I apologize actually for this slide because as I'm looking at it right now, I feel like that purple should be darker. And if you're having a hard time reading that white on top of the purple, maybe that's something that we can fix if this presentation is to be shared in the future. We'll make that a little bit darker. I know that's probably hard to read for some people. But some of these factors that are contributing or leading to an increased number of incidents and severity and frequency and all of those things, these are just some thoughts, right? Some things that are going on. We know, like, I don't need to tell people about this polarization of issues. This is becoming hugely concerning. And I think we've always had different views and different perspectives. I tell my kids all the time, I tell myself all the time, like, it's a good thing that we don't all agree on everything all the time. How boring would that be, right? It's good that we have different ideas, different opinions, different priorities. We think different things. We like different colors. Like, all of those things are good. But what's happening now is we've lost the ability to look at other people's perspectives or through their viewpoint. And we think that if someone has a different view or standpoint or ideas than us or a different way of working than us, that they're wrong and we're right. And we get into sort of this conflict, right? And trying to convince others that what we're doing or what we're saying or our beliefs and our thoughts are right and other people are wrong, instead of understanding that, hey, people have a different opinion and a different view. And just because it's not mine, it's okay. It's okay that we don't all agree on everything, right? That would be a really boring way to live. But I mean, I don't need to paint the political pictures, whether that's in Canada or in the United States, and this really sort of mentality of, fighting and, trying to convince other people that our issues are right or wrong. So many issues, right now, whether it is, we can go back to when this survey was done around COVID, whether it was masking policies, vaccine policies. Now it's more political. We've got wars and conflicts across the world. And most people don't sit on the fence on those issues, right? They feel really strongly on one way or another, and we're all working together with these various viewpoints and ideas and opinions. And we feel like if someone doesn't agree with us, then there's something wrong with them. But that's not true. Okay. And we're going to talk a little bit about why, we have these different ideas and why that's okay. Increased levels of stress. That's the second bubble there. Not the second bubble, but the one near the face a little bit. We are living with higher levels of stress, I think, than we used to previously. And I'm not going to say that this is all work related, although I do think sometimes we are working with a little bit more, stressful situations. But what is happening is we're living in an environment right now where we're kind of up here on our stress level. And that can be because of financial stress. It is extremely expensive to live. It is expensive to feed our families, to put a roof over the house, to fill our car with gas. And we're reminded of that constantly every time we go to the grocery store or the gas station. And we're living with sort of this increased level of stress. And maybe we're caregivers for children or for elderly family members. Maybe, there are things going on in the workplace. Maybe someone, has left or resigned, and now we're being asked to sort of take on two roles instead of one. Maybe there's elections going on in your communities, and that's stressful because you don't know there's going to be a change in direction or change in priority. Certainly, we understand that at WSPS, we are part of the greater public service, through the provincial government. So we know that like when elections happen and we get new leadership, priorities change. And that is an incredibly stressful way to work. Just when you think, you're chugging along, you understand what needs to be done, you know what there's budget and resources for and what your job is. And then you have to pivot because there is significant change. That is difficult, right? We need to accept that. Some other things that are up here, I put normalizing policing of others. I found this, just to be something that we do more often, I think, since COVID. I know, in an attempt to sort of flatten the curve, we were very, and even told, like, if someone's got more than like four people in their house or they're not masking, and we sort of felt empowered to tell other people why what they were doing was wrong, instead of sort of minding our own business. And I get that there is some social responsibility, but I also think that it's okay to not feel the need to tell other people why what they're doing is wrong all the time, and maybe, just take a step back if it doesn't directly impact you. So a lot of things going on here that we're seeing this sort of increase. And I can imagine in your workplaces and your communities, you're also seeing that people maybe have a shorter fuse. People are more quick to anger, more quick to have those uncivil, hostile types of behaviors than maybe they used to 5 years ago. So making the connection here with coping and resiliency. People are struggling to cope with the normal stresses of life, leaving them in a constant state of alertness to perceived threats. This is often outside of people's, they're not choosing to live with this constant level of stress, but sometimes things happen, right? And it can be on a day-to-day basis. It can be more chronic stress. Maybe there's, you're living in an abusive relationship or caring for sick family members long term. Maybe again, things are going on in the workplace or there's ongoing financial stress, things like that, can really leave us feeling in this constant fight, flight, freeze response. And when that's happened, we're so much more alert. And then it just takes one or two things that maybe normally we can cope with and respond to effectively. And we've maybe lost that ability, because we're in this sort of constant state of perceived threat. So if we can improve psychological safety at work, if we can try to bring down that level so we're not threatened all the time. It helps to allow people to respond to different situations instead of reacting. So I like to think about responding and reacting very, very differently. When we respond to a situation, it means that we have control over our actions, over our words. We have emotional regulation. We're thinking about how we want to respond, answer, and interact with others. When we react to a situation, that is sort of our fight, flight, freeze response kicking in, perceived threat, and we act in a way that maybe we don't have full control over, because our body is trying to keep us safe from a perceived threat. That's reacting. So again, when we're in these difficult situations, the better we are at responding and managing those emotions as opposed to reacting, we'll have better outcomes. So, workplaces that strive to provide psychological protection encourage workers to ask for help, encourage workers to say, hey, I'm not okay today. And this type of culture can help to minimize these threatening situations and conflict in the workplace. So there are going to be times at work, again, when we're in conflict or we don't agree with someone. And if it is a safe workplace and there is psychological protection, workers will put their hand up and say, I don't understand that, or I don't agree with that, or I have a different idea, or I'm struggling today, right? Or I made a mistake, or I have a question, and it is safe to do that because there's no fear of reprisal or judgment or that it's going to be career limiting. I mean, even as I say that, I get a smile on my face because I'm like, wouldn't that be a really nice way to work, right? Where, we could be our authentic selves and we can come to work and ask those questions and we don't have to try and put a mask on or pretend to be someone else because we're worried about how other people are going to treat and judge us. And that we could say when we're not okay, we can deal with conflict in a healthy way because there's this mutual understanding that we're all in it for the same reason. So, what is psychological safety? Pet peeve of mine, if I can share maybe an unpopular opinion, because I do a lot of consulting in this space, and I'll go to workplaces or different communities, different groups, and I'll ask their leadership. I'm like, okay, so what are you doing for psychological health and safety? And one of the first things that I always get is, oh, we have an employee and family assistance program, or we're doing some wellness initiatives. Maybe they're promoting, a heart healthy month, or maybe they're doing lunchtime yoga or some walking initiatives. Or maybe they've got a policy on psychological health and safety. And those things are good, right? Those are good things. They sound good, but they are not psychological safety. So psychological safety is actually defined as, a state in which workers are free from exposure to significantly foreseeable significant risks to their mental health arising from acts and omissions of other people in the workplace so that there's a low risk of mental injury. And this is actually from the national standard. So we have a CSA standard in Canada that's called Psychological Health and Safety in the Workplace. And that's where this definition comes from. And that definition sounds great, maybe a little bit wordy, but at the end of the day, what we're trying to do is create workplaces that are careful to avoid mental injury. And when you think about that, I want you to think about, if this was around physical safety, right? And all the things that your workplace does to prevent physical injuries. You probably have people that wear PPE, personal protective equipment. You do safety training, whether that's WHMIS or workplace violence and harassment, things that we're talking about right now. You do have machine guarding. You have all sorts of things that you're doing to keep people physically safe at work. What we're saying is if you understand the hazards in your workplace, then you can be more careful to control and avoid those risks. And what this definition is not saying is that there's no risk of mental injury. It's not saying that. It's saying we're going to take a look and try to determine what's reasonably foreseeable and significant risks. And we're going to do something to help minimize that risk and control those risks so that people don't experience a mental injury. So, okay, I'm going to give you an example. I used to work in automotive manufacturing and we made huge truck frames for GM trucks. That was the factory, 1.5 million square feet. It was huge. And let's just say we had a station where an operator, we called them team members, but an employee essentially had to lift 50 pounds every 37 seconds. So they had to lift this 50-pound side rail, load it into the tooling, step back, palm out, right? Every 37 seconds, they're lifting that 50 pounds. You can imagine what started to happen, right? People got hurt. That was extremely physically demanding. 50 pounds every 37 seconds. So they were getting wrist, neck, back, shoulder, elbow, you name it. People were getting hurt. As a responsible employer, we didn't say, hey, worker, go to the gym, go get more physically resilient so that you can come back and do this work without injury. We didn't say that. We said, hey, let's change this work. Let's change the way that people interact with this work. Let's get a lifting device. Let's get some rollers so you don't have to carry that part. Maybe it's a two-person job. We changed the work so that it minimized that risk of physical harm. What happens with psychological hazards is we say, oh, hey, worker, you're experiencing distress. Maybe you're in crisis from things that are going on in the workplace. Here's the EFAP card, right? Employee and Family Assistance Program, or go off on a short-term disability or a stress leave, right? Go take care of yourself. And when you're better, come back and work in the exact same environment that contributed to harm in the first place. That's what we do. That's what almost every workplace does. Instead of actually saying, hey, let's investigate what contributed to this harm. Let's figure out what's going on and make it different so that we don't continue to have workers that are going off work for mental harm. So I get what some of you are probably thinking. You're probably thinking, well, Christy, come on. Like people are experiencing all of these stressors in their personal life. Not everything is work related. And I agree with you. 100% I agree with you. But if we use my example, there are people that may, experience physical injuries or illnesses, right, at home. Maybe they, play hockey, lacrosse, football, like my kids do. We have all of these sports. Maybe they garden. Maybe they do other things that, could put them at risk. It doesn't mean those individuals are not entitled to a safe workplace, right? Maybe we have people that listen to loud rock music or smoke. It doesn't mean when they come to work that they aren't entitled to clean air and protection from noise-induced hearing loss. Of course they are. So yes, we're always going to have stressors in our personal life. We're going to bring that to work. It may be a contributing factor, but it doesn't mean that people aren't entitled to a psychologically safe work environment, that we're trying to minimize those risk of hazards. So let's make this connection here. How can psychologically unsafe workplaces increase the risk and severity of workplace violence and harassment if we normalize toxic behaviors? If we give people a pass for behaving inappropriately and hurtfully in the workplace, and that is the norm, right? Then that is not only psychologically unsafe, but it's going to increase the risk that there is conflict, that people don't feel safe. If there's a lack of trust and respect, that trust piece is huge, right? We need to have trust in our leadership, in the people that we work with and those that we report to, that we can speak up, that we can share our experience, that we can be vulnerable without, again, that fear of retaliation or reprisal. Power imbalance and abuse. So I'll give you an example of this to try and demonstrate it. I worked in healthcare doing health and safety for a very long time. And you can ask anyone, like, who is the most important person that works in a hospital? And often, we hear things like the surgeons, right? Those doctors that are highly skilled and highly trained. But I would argue that every job is important. That surgeon can't do those surgeries and save lives if that housekeeper hasn't cleaned the room, if the nurses aren't there to assist, if we don't have food service individuals helping to care for individuals after. Every job is absolutely important. So if there's this power imbalance and we give people in a position of power, perceived power, the ability to treat other people like garbage, that's not okay. Right. And that happens in healthcare. It happens in so many different workplaces. And we really do need to be careful and mindful. Those individuals that maybe have this more perceived power should try even harder to treat people well and treat them with respect and caring and appreciation, because that sets the whole tone for the workplace. Lack of job security. If there is ever in your work environments this fear that people are going to be let go or laid off, it can create this competitive culture and blaming, right? And saying no personal accountability for mistakes or when we missed something or forgot to do something. Instead, we're always finger pointing and blaming others. That is very toxic, right? We need to be able to take personal accountability. We all make mistakes, right? We make mistakes all the time. And when we can't feel safe or don't, or feel like if we own that mistake, that it's going to be, again, risking our career or our job, then it can help to create this toxic environment. If there's lack of safe reporting mechanisms, every workplace has different ways to report, uncivil, disrespectful, hostile, aggressive behavior, violence and harassment. And if we don't feel safe to report it, then we can't have that under reporting, and it increases that risk because we're not dealing with issues as they arise. So what is this trauma-informed approach? Well, we all react to a perceived threat through this fight, flight, freeze response that I touched on earlier. It is automatic, it is instinctual, it is our body's way of trying to keep us safe from a perceived threat. What we need to understand is that people with past traumas may react in ways that seem disproportionate to the threat. And their body is trying to keep them safe. Their body is saying, hey, either get yourself out of this situation or react with, maybe a bit of aggression or hostile or yelling to try and keep us safe. These past experiences, again, are telling them that there's a danger or a threat. I can give you an example. When I worked in healthcare, I have a dear friend, and she did WSIB claims management. And she grew up in a home where there was a lot of yelling. Parents yelled at each other, they yelled at the kids, like just constant yelling. And as a child, her coping mechanism was to sort of sit in her closet beside her bed in the wall and just sort of huddle and shut down. And that's how she dealt with that as a child. She enters the workforce, and when she was on the phone or employees would come in and start yelling at her, she completely shut down. She couldn't articulate a sentence. She couldn't continue the conversation. She just sort of went into this sort of shut down freeze response because she had past trauma associated with sort of being yelled at and being in an environment where there was a lot of yelling. And her coping mechanisms that she had learned as a child was to just shut down, freeze, don't engage, just sort of isolate yourself. But that didn't serve her well in the workplace, right? So we have to help develop some of those strategies and some of those skills to have different coping mechanisms and react or respond in different ways. So a definition of trauma, it's defined as a deeply distressing or disturbing experience or event that overwhelms an individual's ability to cope, often resulting in a lasting impact on their mental, emotional, and sometimes physical well-being. So when people have experienced a trauma, it's not just an uncomfortable situation. It's not just something that might be hard or that you don't enjoy doing, or, something that, you think about that night and then never again. It is something that actually impacts on us and imprints on us and on our memories and on our responses in the future. It's not to allow for a pass for inappropriate, disrespectful, or unsafe behaviors, but we do need to approach with understanding. So having this trauma-informed approach just means that we are going to ask the why. Why did someone respond that way if it seems disproportionate, as opposed to saying, hey, that's wrong, you need to be disciplined for that. There may be disciplinary action, there may be accountability, but we also need to approach it with understanding. So when we look at prevention, we need to build trust and understand triggers. So for my friend that worked in healthcare, her trigger was obviously being yelled at. That was her trigger. So once we understood that and we created an environment where we could learn and help her, then there were times when, her and I would sit down in a safe place and I would yell at her. And she knew that she was safe and she would develop, starting to respond and how to respond in those situations. But we need to approach it with understanding and not judgment. A trigger is not just an unpleasant, annoying situation. It is something that actually increases the likelihood of re-traumatization. I think we overuse that term trigger. I'm just throwing this out there. Like I hear my kids saying that something is triggering. I hear it all the time when I'm delivering sessions. It is, yeah, you might not like a situation. You might not like that I'm, asking my kids to do something, but that doesn't mean it's triggering because it is not increasing a re-traumatization, right? It is uncomfortable or unpleasant. So I just want to put that out there. I've got down here, like with previous physical injuries, like let's say someone has a previous back injury and we're asking them to lift heavy things or do a lot of twisting and that type of work. It's likely that that's going to increase the likelihood of re-injury of that previous injury. And it is the same when we look at triggers for people that have past traumas. And when we understand what those traumas are, then we can avoid doing those things or changing how we do things to minimize that likelihood. One thing that's listed here, and I think I have a link to it at the end, but if not, I'll make sure I get it to you. It's called this Psychologically Safe Interactions Workshop, and it is through Workplace Strategies for Mental Health. It's a free resource, but it actually just allows teams to sort of get together in a safe environment and talk about how are we going to communicate? What's safe? What's not safe? How should we resolve conflict? How should we approach each other in a way that's safe for everyone? And it really just does help bring teams together and understand sort of what's green light and what's red light when we interact with each other. and don't judge. Be aware of your own attitudes and biases. Again, just because it's not how you respond to a stressor doesn't mean that it's not appropriate or doesn't mean that it's not okay or wrong, right? It doesn't make you morally superior if you respond to a stressor in an easier way or a different way than someone else. Just we all are going to respond in different ways based on our past life experiences and what has worked for us in the past, or maybe we've never developed a skill on how to respond to a certain situation or a certain stressor. That's okay, right? We're constantly learning. And just because you don't know something today doesn't mean you can't develop those skills. Oops, daisy. So a trauma-informed approach to de-escalation, we need to create a sense of safety. We need to understand that people might not be in control of all of their actions. We don't want to dominate. I really like the fourth bullet down there, that regulate over educate. If someone is experiencing a stressor and they're starting to escalate and they're starting to get frustrated and agitated and angry, if we tell them you can't say that or don't do that or calm down or relax, that is educating. That is telling someone what to do, right? We need to regulate. We need to say, tell me more about how you feel, right? Explain to me what's going on, right? Try to regulate, seek that understanding. The low and slow is really helpful. So again, unlike how I'm presenting to you today, which is kind of fast paced because I've got a lot to say and I'm animated because I love this topic and I get passionate about it. But if I'm trying to de-escalate someone, I should actually lower my tone of voice and I should slow down. I should talk slower. I should give people an opportunity to respond. In fact, it shouldn't really even be me talking. I should be allowing someone else to respond, and I am acknowledging and I'm active listening and I'm, really giving that person that sounding board and what they need. The last bullet there called Flip Your Lid, I really suggest Dr. Dan Siegel has some amazing resources. And this concept of Flip Your Lid is that we have sort of our primitive brain, right, as our thumb down here. This is the model that he uses. I'm not taking credit for any of this, but we have our primitive brain, right? This is our emotions, our anger, our frustration, our happiness, right? All of those things live in our primitive brain down here. And then we have our cortex that surrounds our primitive brain. And this helps with regulation, decision making, understanding sort of the pros and cons of different responses. But what happens when there's triggers, and especially with past trauma, if we have these triggers coming in, it actually causes our cortex, right, our protective factors to loosen and our primitive brain response, right? Which is those underlying emotions. So that's what flipping your lid is. And when someone is in a state of, distress, frustration, if they're getting agitated and angry about a situation, chances are they've flipped their lid and they are now acting without reason, right? And likely without a lot of control. Their brain processing systems are not telling them what's appropriate to say, not say, do, not do. They're in that fight, flight, freeze response. And so understanding sort of how this system works. And if we try to talk to someone with reason that is very agitated and we're trying to de-escalate them, we can't really talk to them in the same way that we would if we we're having a quiet conversation with no stressors or threats. It's not going to go the same. So I do suggest that it is a link there. I don't know if you can click on it later. I know the presentation is going to be shared, but certainly check out some of Dr. Dan Siegel's either YouTube videos or stuff on his website, because it does have this really good understanding of sort of what's going on and how to approach and maintain sort of those protective factors, and how we can help ourselves, right? We all get agitated and react sometimes in ways that we're not proud of, but it gives us our own skills and how maybe for our kids or people that we work with to how to not like trigger and pry open those protective factors so that people are able to respond with that emotional control and regulation that we want. So post-incident response. So again, understand that there are some psychological and emotional impacts for all of those involved. Sometimes the person that was escalated, that maybe said or did things that they didn't feel a lot of control over in the heat of the moment, are feeling embarrassed or ashamed about how they reacted or responded. So again, approaching it with understanding. offer meaningful supports. I intentionally put that word meaningful in there because I think sometimes what we do is we offer supports to individuals or we have supports available, but if it's not meeting their needs or it's not how they want to or need to be supported, then it can actually be detrimental. So understand what people need and what supports are appropriate. Review and learn, right? And normalize this help seeking behavior. We want people before they're in a very escalated state. We want people to be able to ask for help, to say, I'm not okay. We want to pick up on those subtle cues, right? Those early warning signs so that it doesn't continue to escalate and we're more effective at de escalation. So that is really important that we're checking in with each other. We're understanding sort of what someone's normal is. And then when we see behaviors or actions that are not their normal, we're checking in, right? We are trying to intervene and de-escalate so that it doesn't continue to escalate. Don't ignore it. Don't poke the bear, right? Be understanding and compassionate. I know I'm almost at a time. I'm just going to take a look at these quick tools and resources. So definitely WSPS, we have a lot of free resources, and all of these resources that I've listed, are free. Even some of Dr. Dan Siegel, certainly there's some stuff I'm sure you can purchase, like his book and things like that, but a lot of the videos and articles and things are free of charge. We have Workplace Violence and Harassment Toolbox. We do offer some situational awareness and de-escalation training. And then we have our Preventing Mental Harm Roadmap microsite. Again, those are free. The de-escalation training, there is a cost associated with that. Workplace Strategies for Mental Health is a fantastic website. It was put together through Great West Life, and it has different workshops. It's got managing trauma at work. It has some great tools and resources for those that are in leadership roles. There's actually a self-assessment survey on like how psychologically safe as a leader are you. So again, all of that is free. Then again, Dr. Dan Siegel's work. And then of course, the Canadian Mental Health Association. They have the Not Myself Today campaign, which is workplace focused, and some really good work, some really good resources again that they have.